Hello and thank you for watching. In this video, I'll be discussing ADD and ADHD. Now, this on its own can be a really big topic, so I probably won't do it justice in 2 to 3 minutes. But the couple of points I'd like to highlight and hopefully get through by the end of the video. Number one, somebody with ADHD or ADD, similar to what I talked about in my autism video, isn't broken. What it means is that the way their brain has been wired is different than other people's, and that difference can also be a very positive thing. Number two, there are lots and lots of people who are on medication and have been told they have ADD and ADHD, but they weren't necessarily diagnosed properly. And one of the things that I see as a mental health practitioner are people who maybe shouldn't be on medication, but they were told early in life that they have something and they've been taking medication when a true diagnosis has never been done. So ADD and ADHD are very similar. The main difference, obviously, is the H, which stands for hyperactivity. A person with ADD typically won't be overly hyper, but they'll still have difficulties in concentrating, potentially some difficulties in impulse control. Whereas with ADHD, it'll be similar, except on top of that, they'll have like an endless supply of energy, and it'll be very hard for them to sit still, and they become antsy really quickly. These people tend to be very creative people, and the reason is their brains are going so quickly. They have so many thoughts coming in and out in a short period of time that they can be very artistic. They can be inventors, they can be innovators. And the challenge for those people is, how do you take all these ideas, all this creativity, and contain it when you're, say, 12, 13, 14 years old, and you need to sit quietly in a classroom? A lot of these people, when it comes to impulse control, have trouble holding their hand down. So for example, a student in class, when the teacher asks a question, right away their hand's up, or they may not even put their hand up. They'll just blurt out the answer. And this type of impulsivity, the lack of control, can also lead to social issues and social challenges, because these behaviors do impact what other kids think of them. The good news is that ADD and ADHD can be treated. So number one is by having a true diagnosis. So the people that are only, to my knowledge anyways, the only people that are qualified to do an ADD or ADHD diagnosis are psychiatrists and psychologists, because they've been trained in the different assessment tools that are needed in order to have a formal diagnosis. So for example, if a child displays ADD or ADHD symptoms at home, but in no other place in their life, then they probably don't fit a true diagnosis. A lot of times what happens is people go see their family doctor. The doctor says, okay, take these pills and let's see what happens. So it could be, I'm not saying that the pills aren't helpful, in that the person may actually have ADD or ADHD, but it's also possible that they don't, or they have some other conditions associated with that, which then the medication choice, if a formal diagnosis is actually done, would be different. When it comes to therapy, it is recommended that if a person is taking medication, that they also go for counseling and therapy. And the reason is, if you think about what the medication does, is it's changing a bit of the brain chemistry in order to allow a person to focus better. Once they're focusing better, then what the therapy can do is give them tools and strategies that they can use in order to help cope and increase their resiliency and just how to deal with their challenges. For some people, they're able to, because of the therapy, the counseling, and just getting older, they're able to reduce and even come off medication because the strategies that they've been taught are so effective that the medication actually isn't needed. So again, this is a really complicated topic. It is something that I have a passion for, and I love helping people with, because working with these people is so rewarding. So I'd love to hear from you if you have any questions, if there's anything I can do to help you and your family. My number is 416-613-1259, or you can reach me by email at kevin@hhcw.ca. Thank you very much.